In other news, the city reported 24 local COVID-19 infections today with no new imported cases. Another elderly patient died from the disease, taking the local death toll to 79. Jacky reports.
A reminder from health authorities today that despite the downward trajectory of infections, folks should remain cautious.
The trend is in a decreasing trend, but it's quite slow, so it's not yet under control.
With social distancing measures set to be relaxed in days, health authorities reminded people to think twice about going out for large gatherings.
With the relaxation of the social distancing measure, I think the public still have to avoid gathering and social activities as much as possible.
This as 10 new infections have unknown sources, with around a dozen more preliminarily positive cases. Among the newly diagnosed are 6 residents and a worker from the virus-stricken Hongqi Leimukshi hostel. 2 new infections on the hospital front too, both are medical assistants. One of them worked at Princess Margaret Hospital and had come into contact with a COVID patient, while the other did not. Both are not responsible for the clinical care of COVID patients. An 18-month-old boy admitted to the Children's Hospital for surgery was confirmed with COVID-19 today. His family has been sent to quarantine. A 50-year-old waitress at the tea house in Mongkok's Pioneer Center also came down with the virus. Other new infections come from various sectors. They include a privately employed chauffeur, a security guard, a customs officer, a renovation worker, and a retiree. Jacky, TVB News.
The government has announced registration details for the citywide COVID testing scheme, which starts on Tuesday. Once again, officials responding to critics of the scheme. Dongyao has details.
Less than a week from the start of the universal COVID testing scheme, and the government has launched an online registration system for it. Starting Saturday, residents can make online appointments for a preferred testing time and location using their identity and contact information. Those registered will have their nasal and throat swab samples collected by medical staff at a chosen community testing center. The government says it has organized more than 100 specimen collection centers in all districts, each adopting preventative measures and a cap on the hourly testing capacity to prevent cross-infections. Those who take the test will receive their results via text messages in 3 days.
Secretary for the Civil Service Patrick Nip, who is in charge of carrying out the mass testing, said more than 5,000 healthcare workers have joined to assist with the scheme.
In response to those who doubt the program's efficiency and effectiveness, Nip says each day society pays a heavy price for the pandemic and virus control measures. Thus, the universal testing scheme can reduce the social cost by identifying silent COVID carriers quickly. The exact locations of the testing centers will be reviewed in the coming days.